Ron Labonté at the University of Ottawa, and I co-lead the Global One Health Network. I've only recently been exposed to the One Health concept itself, although in practice, much of my work in public health has always been organized around the idea that we have this interconnectedness of different spheres of our biological existence. Now, what's really interesting about One Health is it draws particular attention to the relationship between animal health, human health, environmental health. But with the Global One Health Network that we're establishing, it's also bringing in the social science side. So the social health components of how all these pieces fit together in terms of creating either risks or opportunities for greater health equity. And to that extent, it's very important to the kind of research I've always done and the research I hope to continue doing. Our global One Health network is a bit unique insofar that it was established specifically to bring more of the social sciences. So social sciences, we're talking anthropology, sociology, political science, economy, all the different kinds of aspects of disciplines to try to understand how our societies are formed and how they function and how they relate. This is quite unique in terms of looking at One Health, which has previously tended to emphasize more the relationship between animal health and human health. So we're trying to bring in a much broader range and a much deeper analysis or understanding of how our social systems, our social organizations influence the risk or possibilities of transmission or control of these zoonotic or novel new infections. And alongside that, how it also affects the problems associated with increasing antimicrobial resistance. One of the great opportunities of working in an interdisciplinary network that combines the human animal health sciences along with the social sciences is that we are in a unique position of learning a tremendous amount of new stuff from each other. So it's quite wonderful to be confronted with a whole different language that comes out of the veterinarian health side, or the human health I know pretty well, and I think for a lot of the other people who've been studying more the traditional One Health, animal-human health relationship, to be confronted now with all of a sudden social science concepts and social science language. So we're working actually quite hard at trying to create a common understanding or glossary across these different terms. Because to be truly transdisciplinary, we want to be able to ensure that the questions that we ask, the research that we generate, and the new intelligence we might be able to create around more effective global governance of infectious disease and antimicrobial resistance, that it really does embody all of the composite knowledges of these different disciplines so that we take into account how social structures might influence the ability to look at the human and animal health intersections, and to try to bring in more in terms of how it's also affecting the physical environment and how that feeds back into, ultimately, improving human health and human health equity.